First Contact Clinical is leading a new care navigation pilot in North Tyneside. It seeks to embed care navigation within all local practices. We believe that care navigation has the potential to improve patient experience, empower practice staff, make the best use of community assets, and create efficiencies. Care navigation can produce some great outcomes, but it requires a supported and coordinated approach. We hope that all patient-facing admin staff can become care navigators, and that care navigation becomes streamlined, consistent, and valued. This is an exciting time for our local health system.
My name's Helen and I'm one of the psychosocial link workers as part of the North Tyneside Social Prescribing Service.
I'm Kirsten Richardson, I'm the Clinical Director of Wallsend Primary Care Network.
I'm Dr. Dave Thompson, I'm a GP, I'm the Clinical Director for North Shields Primary Care Network.
My name is Philip Horsfield, I'm the Practice Manager at the Village Green Surgery in Wallsend.
I'm Lisa Hornby, my job is Lead Care Navigator within the Village Green Surgery.
So care navigation is about the first person they speak to, directing them to the right place to get the help that they need.
Those single issues for patients where, it's a straight signpost, they need citizens' advice, they need a particular service, going onto the Living Well North Tyneside website.
I had a gentleman that rang up to just order a prescription, and in the conversation he said that he had no one to pick up his prescription, or he had nobody to talk to. So I've directed him to the befriending service at Age UK. I sent the referral through by him requesting, and they contacted him, and he now has a friend that rings every week.
If a patient comes to see a GP and is suffering from low mood, they might need a mental health appointment, but actually it might be because of a gambling problem or a financial difficulty, and if we had directed them to that resource first, that appointment would be used more appropriately at a different time or by a different patient.
So with good analysis of what people are coming with and good knowledge of what's out there, care navigation can really help signpost people away from the front door of seeing GPs and other health professionals and medicalising their problems.
So we're introducing this care navigation pilot to help train our reception staff to become care navigators and to develop a training programme so that this stays embedded in our teams as they grow and as staff come and go.
My role supporting the Care Navigation pilot is mainly to facilitate the work and development of the team. We're keen to make sure that we develop our receptionists through into care navigators on an ongoing basis to ensure that we've got a vibrant modern workforce.
So what I'd like to see is that care navigation becomes a core part of what is done in all general practices in North Tyneside and what patients expect.
The care navigation scheme should be able to help a lot more people. We can direct them much quicker and less time and stress on the patients.
Once people see how beneficial it is and how much more enjoyable it makes their job, the practice will then be able to prioritise it and reap the benefits from it going forward.
For us, I'm looking to develop the team even further, and also I'd like to see it developed wider across the greater borough.
I think the care navigators are going to do a fantastic job of really supporting us in our roles, and vice versa, you know, we're here as a support for them as well.
But I'm convinced that if we have receptionists who are valued, paid adequately, and given the training to be able to be a really useful part of the front door and start seriously redirecting people that don't need to see highly trained health professionals, it will be an investment well spent. So we have to invest now if we're going to make the changes that we need for the future.
We all have a part to play in turning this vision into a reality, where all patient-facing administration staff become care navigators in both role and title. What can you do to help ensure we achieve this?